Sickle cell disease is a very serious condition. It's a genetic disease that affects the blood, the hemoglobin that is inside the red blood cells. So it affects how oxygen is distributed throughout the body. The most common complication is pain. So when the cells with sickle cell disease sickle, they interrupt the circulation. And when blood doesn't flow, there's something that we call ischemia, and lack of blood causes pain. So the most common complication of sickle cell disease is pain, what we call the pain crisis. This pain can be mild, easily controlled by medications that you can take at home, or it can be very severe that you have to come to the hospital and take IV medication.
Sickle cell disease is very serious. It is potentially life-threatening. It's lifelong disease for many patients. It involves every organ of the body potentially, and producing not only pain and discomfort, but also organ dysfunction, serious organ dysfunction, and potentially life-threatening complications.
Here at Methodist, what we have is a multidisciplinary sickle cell clinic. And what it means is that we have professionals from different disciplines working together in the clinic. So we have physicians, nurse practitioner, psychologist, social worker, nurse educators, and nurse, all working as a team to provide comprehensive care. So what we do in sickle cell disease, we do what we call a medical home for people with sickle cell disease, which is 360-degree care.
When patients come to a comprehensive sickle cell clinic, they can get good health maintenance for one, good routine care, checkups, x-rays, important laboratory. They have access to clinical trials, some of the newest and latest medications, and eventually here at Methodist we hope to have more and more clinical trials available to our patients. We have infusion area for patients who are experiencing an acute pain crisis to help potentially alleviate the need for emergency room visits and possibly hospitalization.
Methodist Comprehensive Sickle Cell Center is specialized in treatment of people with sickle cell disease, and we do understand from head to toe and beyond the walls of this clinic what's the extent of involvement of this disease. So you want to be treated where people understand the disease, and that's what we do here.
I think this particular clinic is very unique in that it is a collaboration between St. Jude and Children's Hospital and Methodist Adult Hospital. So the transition from childhood to adult care is almost seamless, and it's one of the few comprehensive centers where there is such a close collaboration between the pediatric side and the adult side.
And since we have this partnership that St. Jude employees work side by side with Methodist employees, we know the patients from before they came, so there's very good continuity of care. So we really have a good continuum of sickle cell care. And the other thing this partnership does, besides taking the care to a different level in which you don't really have any loss of information as you move from one institution to the next, we also have the opportunity to share our research between the two institutions. St. Jude is very famous for doing research for people with conditions such as sickle cell disease. So a lot of the research that we offer at St. Jude, we're able to offer the patients here at Methodist. I think our patients are thankful for what we offer here. I think the fact that we have this multidisciplinary team that look at all the different aspects of the disease is a plus. I think the patients recognize that. I think they also like the fact that we can treat their pain here in the clinic. We have an infusion center, so they can come here instead of going to the emergency department, and they're expedited. We see them right away. So I think they're thankful for all the resources they were able to offer in this clinic.
When I come here, it's like I'm at home. It's very important because without them, I don't know what's going to happen to me. They've been so good, and I like it.